Hi, today we're going to be learning about how to do a dependent skill of moving a patient from sideline, as you see here, to a prone position, which is on the stomach, and then back from the prone position back to the sideline position. You'll also learn how to properly obtain consent from the patient and how to provide patient cues to maximize the efficiency and the safety of the patient. This skill is an important skill for providing access for interventions, providing comfort to the patient, and also for relieving and preventing the risk of pressure ulcers. Before you do any kind of movement with the patient, you should always obtain consent. So hi Ethan, I'm Rob, I'm going to be your student physical therapist today. Is it okay if we move you from your side to your stomach?
Yes.
Okay. Once you do that, it's important to survey the table or the bed. Make sure there's not any IV lines, catheters, or oxygen tubes that are going to get in the way or tangled during the movement. Once you've surveyed that and they're clear, you want to make sure that the patient is properly clothed. From here, we're going to go ahead and start to move the patient. So this sideline position, the patient is in a slight forward rotation of the trunk, along with the left lower extremity is in a flexed position. This provides stability, yet it's important to make sure that you stay behind the patient, that way they don't roll back, and to also just control the patient. So from here, we're going to remove the pillows. We'll go ahead and bring the arm of the patient up by their shoulder. The other arm we will bring up over their head. And we'll move the left lower extremity on top of the other. So now that the patient is in a straight line, we want to do one last thing. And we want to put a towel underneath their forehead. That way when we roll the patient, they're not going to be faced into the pillow, and it provides time for us to reposition the head. Also, before, you want to ask the patient, depending on their range of motion, which side that they would like to have their head rotated. So Ethan, would you like to have your head on the left or right?
Left.
Okay, once you've established that, it is time to move the patient. So we're going to start with our hand on the front of the shoulder and the hip, and we're going to initiate the movement this way. And as the patient rolls towards the table, gravity is going to take over, so we're going to shift our hand to the front, so anterior part of the shoulder and anterior part of the thigh. So we're going to give you a countdown. We're going to move on 3. 1, 2, 3. First things first, moving the patient's head to the side. Then from here, we can reposition the patient's arm for comfort. Reposition the pillow. We can remove the towel. Reposition the other arm. And from here, we can take and put pillows underneath the patient's trunk, underneath the patient's hip, or underneath the patient's legs for comfort. Moving the patient back from the prone position, so on their stomach, to the side, it's nearly the same. First, you want to make sure that you obtain consent from the patient. Is it okay if we move you to your side?
Yeah.
Okay. If the patient is in the center of the table, it's important to make sure that they're on the opposite side of the table. That way you have the most leverage and they are in control of the patient. So first thing we'll do is move the patient's head, shoulders, thighs and hips, and legs to the opposite side of the table, moving them in individually and making sure that the body stays in alignment. From here, we're going to take the right arm, bring it up overhead. Left arm is going to be tucked underneath the patient's hip. Left leg is going to be crossed over the right leg. And from here, you're going to give the patient a countdown, and you're going to roll the patient to their side with your hand underneath the anterior part of the shoulder and thigh. So we're going to move on 3, okay? 1, 2, 3. Once you're in this position, you want to restabilize the patient. So you can bring the patient's arm down to make it more comfortable. And then take the patient's left lower extremity, put it in a flexed position, and then slightly rotate their trunk and provide the patient with pillows. One underneath their arm, one underneath their leg, and then a towel underneath their malleola. Okay? They're in a stabilized position here, so it's important just to make sure that you stay behind them. That is how you do a proper dependent skill of moving a patient from sideline to prone, and then from prone back to sideline.